Hello, I'm Dr. Bill Wyatt, and I'm a member of the AOS for the American Orthodontic Society, and this is a society of general and pediatric dentists that incorporate orthodontics in their regular practice. And if you're interested in, you're a dentist, of course, and are interested in doing orthodontics, we encourage you to join the American Association or the American Orthodontic Society, uh, and we teach all sorts of courses in orthodontics, and we'll teach some very good uh, courses and can really learn orthodontics in this organization. Today I'm going to discuss one aspect of lectures in orthodontics, and that is on second molar extraction cases. And we'll go through several of these cases and kind of give you some idea of what you can do in crowded cases by extracting second molars. This little patient that I am going to show here is not protrusive at all. She has a very good face, in fact, and a very straight facial profile, which is very good, and a good vertical height of the face, and it's divided up in good equal segments, and so this is a good face, what I would call a good face, and it'll be easy to work with. Looking from this angle, it has the same characteristics too, and when she smiles, of course, she's got some crooked teeth there and a few teeth missing and stuff like that. I've got a badly rotated central, and we're going to try to turn that central around and improve that. Now you'll notice that there are four anterior teeth up here, and there's only, well, the deciduous cuspid, which is gone over here, but still has it present on this side of the mouth. So usually the midline is shifted in this direction. So you have only two deciduous teeth left over here, and you've got three deciduous teeth on this side. Of course, these are permanent 6-year molars back at the back. We'll look at the lower arch, and we've lost a deciduous first molar here, and we still have it, of course, on this side, and the cuspid teeth are really crowded out. In other words, you need to put a cuspid tooth in that area. And it's possible not to extract teeth in the front part of the mouth to bring this in, and that's kind of what second molar extraction does. It gives you some space to back up the teeth back in here and open up space in this area where we need the cuspid, needs room for the cuspids to come in, of course. Okay, when we put the models together, we have they're not fitting together. Let me look at the teeth back here. They're kind of a little open bite situation. The teeth fit together apparently better though than the models that I'm trying to fit together here. We've got quite an open bite in our model, so there could be some problem in trimming those. This was back in 1988. So here we're marking the second molars that we plan to take out. In this case, these teeth right up here that are still underneath the tissue. And again, on this side, we're going to remove those teeth probably a little later down the line. Okay, here we are looking in the mouth, and it's a little later. This is 1992. We're watching the case, and the deciduous teeth are coming out. So we're had planned this way ahead of time to extract those second molars to give us some, let us have room enough to bring those permanent teeth in. So here the second molars have been extracted, and we're opening up and starting the active orthodontic treatment on this case. We got a spring in there. I'm gonna run through this pretty fast, but we've opened up adequate space now for the permanent cuspid. The cuspid is in on this side. Everything's in over here. We've opened up space, and probably the midline is pretty well lined up at this particular time. And we'll come in here and remove these, or have the dentist remove the regular dentist remove the second molars. We'll show this on the x-ray here in a minute. So here's our cephalometric on this particular case, and we do have an open bite in here, so you got some kind of a problem. And we've got a little class 2 situation here with the lower anterior teeth and the upper anterior teeth. Not a big problem in there, but it's class 2 even back in here in the molars. So we're going to come in and eliminate these teeth right in there. Here is a panoramic showing it early on. We started seeing this little girl back in 1986, and she was about 6 years and 4 months old. We just kind of planned out what we were doing. Here, this central was really badly rotated, and they've got a kind of a malformed tooth in this area, which we took out. That'll probably show in the next picture. So that has been removed to let let the central rotate or come on in. It'll probably rotate some as it does come in. She's got some decay in these deciduous molars, and I don't think they were filled or not. I don't know whether they were actually filled. She's 6 years and 9 months old at this point. Okay, the deciduous teeth are still there. She's 1988, so she's age 8. That central has come in up here, but it is badly rotated at this point. And she's got some pretty big lateral teeth, over here. At least that one looks bigger. This one looks bigger than the one over here. Maybe something in our panoramics that we took. It's not a bad, this is not ideal class 1. The molar should be further out here for it to be a good class 1. And then we've got these 2 teeth that need to come into this area. Now the deciduous second molar here is much larger than the bicuspid, so we'll get some relief here, but this space from here over to here is definitely not adequate for these 2 teeth to come in. So we're going to have to do some expansion, and of course these 2 teeth coming in here, you got a pretty bad decay there. Now by not filling that tooth, probably she lost some arch length in here. That tooth drifted into where this cavity is in that tooth. Okay, let's go and look at this is 1988, she's 9 months old, and here it is, and she's 9 and 6 months old, and this is 1989, and we've put on some braces on the upper teeth, kind of a first phase thing, and we're going to try to open up this gap for this cuspid to come in right here, and we've got more space over here for this one to come in, so probably our midline has drifted over in this direction some, because this tooth was lost earlier. Down on the bottom, it looks like we have a little more room. We'll have a part of this, and so we're not too far off in here. Just getting room for these two teeth to erupt in the mouth. Now we'll got a first phase thing here where we kind of line those teeth up, and we caught this tooth early and started rotating it around. That's upper central that was rotated. Now here's 91, and she's age 11 and 8 months apparently, and we've taken off the first phase orthodontics at some point in there. Maybe, I don't know whether we had a retainer on her or not, but we still haven't taken these second molars out, so we're thinking of doing that to gain some space between here and here. That lateral still looks bigger than the one over here, so maybe we'll look at the clinical size of the tooth after a while. And we need space in this area and here too, even though they'll be pretty crowded in that situation. Okay, here we've lost this deciduous molar over on this side, and so we're planning to take that one out to clear that up. And at this point we were thinking of taking out the wisdom teeth, but it'd be way on down the line to get some help that way, and so rather than do that, we marked the x-rays showing that we had thought about doing that back in 92, and she's look like I've marked out her age. I don't know. Okay, we wrote on the Panrex extract age here, but we changed our mind down the road. Alright, here it is in 93. We started the orthodontics, the finishing orthodontics now, and so we decide rather than take out the wisdom teeth, we'd come in and take out these second molars, which is going to let us back these teeth up pretty easily, say, to gain room in here. So we'll be backing all the teeth up from here back, and probably keeping the upper anterior teeth pretty much where they are, or where they have been all the time. Now this is 93, and I don't know whether I've scratched her age out or not, but she's 14 years old at this point. This is 11 of 93, so she must have been about 13 or something when we started this. So we've extracted these second molars. You see they're gone, but she had good wisdom teeth, so if you do any second molar extraction, make sure they've got wisdom teeth. Now these teeth will erupt in right in this area. They'll come up over here, and these roots will be pretty well parallel when they come in, and this will drift forward over here, and the roots come in pretty parallel. We'll see what they are here in a few minutes on this. And we watched these cases for a long time. See, this is the 8th Panorex that we've taken, and this is 1993. It's almost 94 at this point. Now let's see if we got another one. So the wisdom teeth, you see, have drifted on their own. If you go back and just look at where the wisdom teeth are, and look how they drifted closer. And we back this up in that time, so probably these teeth are further back than they really were when we first took those second molars out. And now we've got all the teeth lined up in here, pretty good shape, and we've probably got a little better class one relation in here, and it's better over on this side also. Now at this point, it's hard for me to tell. This is our 10th x-ray, and that's 90 something. I can't tell the date exactly. So here we finished the young lady, and this is 97, and she's 18 and 2 months. So I don't know whether she's been finished for some time probably, but I wanted to point this out, how these teeth just drifted up in there. I'm going to back these x-rays up so you can kind of watch those wisdom teeth are coming forward, and if I had anything on them at all, I'm sure I didn't, because they hadn't come in when we were finishing the case up. Now at this point here, we extracted those teeth, and that space will close as we back the 6-year molars and the other teeth back slightly to gain room, and then the wisdom teeth continue to drift forward. And I think we're about finished for the case. The wisdom teeth have come in, and here we have finished it, and the lower teeth, the lower wisdom teeth are in pretty good, and we've got a good class 1 relation. So this tooth may come up and butt against the upper 6-year molar while we wait on this one to erupt into the mouth. Sometimes they don't bring the roots forward in here. If this is the upper second molar will come on, the upper wisdom tooth will come on in down here and hit this tooth, then these roots would come a little further forward. But I wanted to point out how paralleled these roots are, but you can get some idea that this is drifted. If you look at the roots on the molars, they're kind of tilted back, you see, where they drifted. Now this one's not as bad. Right here they didn't tilt all that much, but they do kind of slant backwards when you do this, but they drifted all the way up against the 6-year molars in this case. And that's about the end of it. Now here is her finished case, and that looks pretty good to me. The midline is pretty much on, but it really shouldn't be, because we got a lateral tooth here that's wider than the one on the right side here is definitely wider than the one over here, and we've used that one, so this cuspid is in a good relationship back here, and the midline looks to be a little off to that side. It doesn't show much on this picture right here, and a little bit up here where the midline is slightly off, but not much. And it's fitting good on the other side of the mouth. Now we put a bonded 3 to 3 on the bottom, and we put a retainer on the top, Now never run an arch wire over in making retainers. We come around. Now if we finish the case and the wisdom teeth aren't in, we make a retainer. We may go back and circle back around where that tooth's going to come in and just leave a space there, and then have the labial wires made all the way around. Of course, it has some little expansion loops in this part right here, but we leave an opening there for those teeth to come in. If they're really bad, we sometimes put a kind of a pad or something to catch the tooth from the bottom. Now down on the bottom we put a fixed 3 to 3, and the lower wisdom teeth came in earlier. Now see, I've never touched them because they just now come in really after I finish the case. So they drift forward and they're pretty well lined up and everything. The problem is that if you do get them coming in rotated or something else, you've taken everything off by this time, and so that makes a little problem if your wisdom teeth are out of line when they come in. Now if they're still tilted real bad, we can straighten that up by just bonding a wire to these teeth and put a little molar uprighting spring in, bring it up, and it'll kick them back and they'll come together okay. But I don't do very many second molar cases. It's very, very few. Whitsick kind of made that popular, and a lot of people were doing it. Even some people went up, took these courses, came down, took the second molars out, and then they looked and they didn't have any wisdom teeth, so that was pretty dumb, but that happened in some cases that I knew about. Okay, this side worked out all right. You could have stripped this lateral, but we're using it pretty good. There's one other little thing to point out here, that these teeth, if they have large marginal ridges that mound up back here, you need to trim those off and make a little shelf in them, you see. These aren't bad, but on Orientals and Hispanic people, a lot of times you'll have a large marginal ridge in this area, and so you have to trim those down. Otherwise, these teeth right here will hit these. Maybe a tooth will hit it on one side and not on the other. Well, that tooth is bound to rotate over a period of time if that's there. Then we'll probably talk about that on a lot of other cases that we'll have down the line too. Okay, here's the young lady's face. By doing the second molars, we didn't lose any profile. She had a very straight facial profile when we started, and she's still, so we kept the anterior teeth pretty much where they were in finishing the case. Still good facial height and everything and finish up. Now that badly rotated tooth, either she hadn't been wearing the retainer good, but that tooth has tried to rotate out some more. I don't know if they look pretty good on and here she is when she was a little girl. That tooth was rotated, and it has again done some rotation right here. If she had worn that retainer, I don't think that would have happened. So anyway, it's not perfect, but we made it without. Looks pretty good, but we've got that tooth rotated. We should come back and straighten that thing out. But she must have not worn a retainer, because it would have. Let me see what the tooth would look like. At that point, it's still out just a little bit, you see, right in here. So we should have rotated it more. It's not perfect over here either. So we didn't do a very super good job of this case, looks to me like. Alright, so that's rotated. Now here's another case that we did. Now this young lady, I'd worked on her, one other member of the family, and we took these second molars out. But first we did the slicing technique that we have. We came in and trimmed those deciduous teeth up, and we had lost this one right here, and we've lost this one. So in this particular case, I think we end up extracting this and trying to make room for these teeth to come in. But we're going to end up taking out the second molar. So this is the first Panorex we've got on her. This was in '72. Now, at this point, we're quite crowded. We have 3 teeth down here to get into this spot, and 3 down here trying to get in where 2 teeth are, and 3 up here getting in where virtually 2 teeth. We've shaved this tooth off and did a pulpotomy, but we have a crowded situation here. Now, you never take out the second molars. You don't take them out unless you got a wisdom tooth. So here is a wisdom tooth that's forming back here, and I can see something forming up here and here and here. So, but I don't take them out when that's all I see. So I'm gonna go here with this other. Let me take this next pantograph. She's 8 years old at this point. That's 76. We haven't done anything other than just allocate some space. Now the teeth are coming in, and amazingly they're getting in better than we thought. And we did the reduction of this deciduous tooth right here, this molar. You take it off and do a pulpotomy down in here, and it gives you almost enough space to bring these teeth in. It sure helps. Anyway, so we'll see what we accomplish by doing that. Alright, those teeth made it in the mouth, but they're pretty doggone crowded. Now, we have never, to my knowledge, we never did do any orthodontics on this girl. I mean, never put any braces on her. But what we did was kind of allocate this space out to them, and they made it in. They had to force their own way. She's probably functioning real good. Now, at one time, we thought of taking the wisdom teeth out, but then I came back, and this is lined up, and I need some space in there. I just needed to come in there. But so we extract these second molars on this case, took them all out, and we still haven't put any braces on this girl at all. And she's 11 and 5 now. This is 76. So we take those teeth out. Now here we come in and put braces on her teeth. We've fixed everything up. It's 1978. She's 13 and 2. And we've got these wisdom teeth that are way back behind again. And let's watch them drift forward. So she's finished up, except we sure didn't get, we've got the crown looking pretty good on this tooth, but boy, the roots are tilted up like that. Let me go back and see what the roots, that tooth always, it's just got some crooked, it's got a crooked root on that thing. Looks like that root formed and went like that in there. So maybe if the root's out of line, the crown's looking real good, we would tend to leave the root out of place and finish the case with the crown looking good, even though the root goes over there. It looks like it interferes with the other bicuspid. Okay, let's watch the wisdom teeth that they go for now. This is without anything. We finished the case now, see. And those roots, this crooked tooth with the crooked root doesn't touch this one, but it was just crooked to start with, but the crown is lined up real good, so I would say leave them. Now these wisdom teeth have drifted really good. Let's see on the next Panorex where they went to. They came right up in underneath there. Again, the roots have a little tilted direction. You see, it's coming in this one and that one too. The sinus is down in this area. She's got some rather large sinuses. She's age 17 and 2 months right now. This is 1983. And I don't know whether I have another Panorex or not. Well, I do. And the upper wisdom teeth have dropped in, and that's looking good. I mean, it's really worked out great in this particular case. Now, I have done a lot of this second molar extraction, but this one has done quite well. This is 1990. And the upper overbite overjet looks good. They're in a good solid class 1 relation. And we had her completely finished. Now just to refresh your memory, let me go back through that, see where the wisdom teeth were coming down. And they drifted like mad. And here's where we took the second molars out. They hadn't erupted fully in the mouth when we took them out. And watch what happens. That gave us some immediate relief here. Whereas if you're talking about the wisdom teeth, you'd have to go back and take them out to expand this arch. So it has some virtues in this second molar extraction. So now we took them out, and those wisdom teeth just drifted right up in there. Now a lot of people wouldn't, just off the cuff, if you're not doing very much orthodontics, haven't done many of these cases, you wouldn't think they could possibly drift in like that, but they've done it without anything. And now this tooth's cocked out like that. Watch then, this one's like this. It's cocked a different way, but watch them when they hit. As those teeth come together now, you see how that thing straightened up? There's pressure on it here, lined up. It's not touching right now, but I'll almost tell you that over a period of maybe a few years or something, this thing will come in and be touching all the way across this root. May move back just a little bit on its own. That crooked rooted tooth looks better. And that's probably at the end of our Panorex. That was number 8. Here she is cephalometrically at one time. This is 76. And there it is in 90. And the wisdom teeth are in. And that's pretty good. It looks quite nice in the mouth. You've got a little discoloration on cuspid teeth. I don't know whether she's brushing all that good or not. But that's a good stable case. We'd put it in retention, and it's a solid class 1. And these are wisdom teeth now, back here in the back of the mouth. So don't be too quick to throw away or get rid of wisdom teeth. Sometimes you need them. Now we use a lot of times if they have a rotted or bad 6-year molar, we'll extract. That's happened to be a second molar. Well, no, this is a first molar, and the second molar's gone, and these are wisdom teeth that have come in there. But if they have a bad first molar and they've got wisdom teeth, we'll take the tooth out and slide this tooth up in that area to bring the wisdom tooth down to include against the second molar on the bottom. So don't be too quick to extract your wisdom teeth. You may want to move them forward. Now looking in here, That looks darn good to me. It's lined up. You have the lower teeth are gonna get all this mess on there when I hit that wrong. Let me go back and get that back up. But anyway, we've got nice grooves down through here where the buccal cusp of the lower teeth fit in to that groove, and that's what you're after. The bottom teeth are lined up good. Got a little rotation down here, but not much. And that's the end of this second molar extraction. I just showed those two cases. It is a useful thing. It's good to know in doing that, so you may want to decide to do that. Now, some of the virtues are you made space and you didn't back up these teeth at all, really. And so when you take the second molar out and you've got the wisdom tooth, these teeth can go back very easy and lines this up, and these can stay virtually where they were. If they're where you want them, then you could keep that. Now, if you were not didn't look nice or that wasn't full enough in there, well, you might want to keep this in, let the wisdom teeth push on it a little bit, and then extract the wisdom teeth or something. But these are different things you can do in the orthodontics. Okay, so that's all there is to the second molar extraction. So I'm gonna end this case or end this video, and we'll just stop it.